Kinesthetic perception is the ability to sense the position of your body components and how your body components need to work together in a coordinated fashion to perform a movement task. So if I were to give an example of kinetic perception, it would be looking at a board, but writing down what is on the board without looking on the paper. Okay. Kinesthetic perception is supported by various components, namely Golgi tendon organs, muscle spindles, joint proprioceptors, cutaneous receptors, and the vestibular apparatus. Now, joint proprioceptors work in a coordinated fashion to provide a recognition of the positioning of body components and the speed of body component movement, while muscle spindles and Golgi tendon organs are both mechanoreceptors because they respond to mechanical differences, namely the length and contraction of muscles. Cutaneous receptors monitors change in temperature, pain, and pressure. The vestibular apparatus monitors changes in head motion and the position of the head. The vestibular apparatus plays a key role when it comes to static and dynamic balance. This leads us to the conclusion that kinesthetic perception is crucial for balance, motor development, preventing injuries, sensing body position, and posture. The two factors that are crucial to develop when it comes to kinesthetic perception are body awareness and spatial awareness. Now, body awareness refers to the ability to recognize where body components are and what is required of those body components to perform the task at hand efficiently. Now, it is important to understand that when developing kinesthetic perception, you also need to develop these two factors. So, to optimally develop body awareness, you as a practitioner needs to instruct children by asking them where the specific body components required to perform the task are and what they are required to do to perform the task at hand. Okay, spatial awareness is the recognition of body size and the position of the body compared to objects surrounding it. Now, spatial awareness is optimally developed when you as a practitioner give activities to children, such as to place objects in storage compartments that are similar in shape and size. One thing that is crucial to understand is that children learn better through active participation than through visual observation or verbal instruction. This does not mean that visual observation and verbal instruction is irrelevant, but it means that you need your children to participate when teaching them. Kinesthetic perception is best developed when children participate in a variety of sports or activities. Meaning, if you want your children to participate or if you want your children to increase in their kinesthetic perception, you need to help them participate in many sports, many variety of sports, meaning cricket, swimming, rugby, because if they are participating in these many sports, that means that they will increase the way that they learn certain skills, because you can maybe learn something from rugby and then apply it when it comes to hockey. This is crucial when you want to learn and when to increase the amount of kinetic perception in children. Okay, children who participate in a variety of activities develop better body and spatial awareness. Now, this includes a better relationship between different body parts and types of movements. This means that you will develop body movements in a more coordinated fashion and that you will increase the way that you perform these activities.
Okay, so next we have the influence that hearing impairments have on the development of kinesthetic perception. Okay, so there are three effects that the auditory system has on kinesthetic perception. Firstly, it helps with the detection of oncoming objects. This is, you can see it through a baseball swing. As the ball comes towards you, you will have a better visual and perceptual view of where the ball is in the air. Then secondly, helps with performing a movement in the correct rhythm. Now, this is actually something I can personally say is, for example, with jump rope. If you perform jump rope without headphones or anything, you can hear the rope hitting the floor each time. It helps you keep the rhythm and therefore perform better. But once you put headphones on and it cancels the noise of the rope, you would actually find that your feet will touch the rope more and you'll fail more, and therefore it actually helps improve your rhythm. And then thirdly, we have it increases the stabilization of an individual. Now, this was actually done by Professor Lenny Gandemer that they actually performed an experiment on an individual where a sound source was rotating around the individual, and they found that through the sound source making sound, they actually found that the individual's stabilization was actually better. So the individual had less sway, so he standed more upright, his posture was better, and you could see actually he standed more still than without the sound source. Then an extra thing with this is that actually the auditory system helps you, like the practitioner, and the child or the person you're training. It helps you communicate with one another. So that's just an extra thing, how it can influence the performance or the outcome of instructions.
So for our first activity, we're going to do an obstacle course, because as a child you need to have fun, and we're increasing our spatial awareness by knowing which objects are surrounded and surrounding you. So how we are going to do this is, I'm firstly going to run and I'll demonstrate right now, but it is critical to know as a child what objects are surrounding you. So that is the goal of this activity, is to ensure that the child knows what objects are around them, so that when they get into a sport environment that they actually know where their teammates are, and to ensure that they are physically capable of ensuring that they know who is around them.
Okay, so for the next exercise, what we're going to do, so one person's going to stand in the middle, the other person's going to swing the hose, so a hose pipe swing. So this is also in account for spatial awareness. This will allow a child to know, okay, this is when the hose pipe or hose pipe is coming towards, swinging towards them, and thus they know, okay, this is how high I must jump, and this is how fast I must jump, and everything. So everything of this correlates to having fun and just also spatial awareness. Awesome.
Next exercise, we will be working on proprioception, and this is for an elderly client. So what we want to do is we want to make it basic to ensure that the client doesn't get hurt in any manner, because we understand that elderly patients are susceptible to injury, so we don't want that. We don't want them to be injured. So we're doing a simple activity. So when it comes to proprioception, the things that you want to improve is your posture, stability, and control. And we're going to do this by doing a squat with the ball against the wall, and this is going to increase the stability and control, and it is performed in a very simple way, and it's performed slowly as well. Like I said, we don't want to inch it. The ball is against the wall, and what I'm going to do is I'm going to lower slowly into a squat position, and then you perform 10 repetitions.
Okay, for our next exercise for elderly patients, we're going to do some yoga poses. Now, the reason why we picked yoga poses is because there's many variety that elderly individual can do, but it also allows for less occurrence of or prone to injury that elderly patient can undergo. Okay, so for our first exercise, we're going to do the downward dog. Okay, then individuals can maybe lift their legs just to incorporate the stability side of it. Then what they can also do is go on your back, just like a glute bridge, and then they can slowly lift the one leg up, other leg up, yeah, like that. So there's many exercises that they can perform to increase their flexibility, but also mostly to incorporate the stability factor of proprioception. Okay, so next we're going to look at the difference in how we prescribe activity to a 6-year-old versus a 70-year-old. So first we're going to look at elderly individuals. Elderly individuals have been through the stage of developing their kinesthetic perception, but due to aging, kinesthetic perception ability has decreased. So there are three ways that age has an influence on proprioception or kinesthetic perception. So first one is it increased hearing difficulties. And this is due to a hardening of the inner cells in your eardrum, but also okay, no, not in your eardrum, but in your inner ear, your internal ear, but also in your vestibular apparatus. And as discussed earlier, hearing impairments decrease the kinesthetic perceptions of individuals. Now, because of the hardening of the cells in the vestibular apparatus, there's also a reduced vestibular function. This results in a decreased balance and posture, and has a tremendous effect when performing specific motor skills. Elderly people, also thirdly, elderly people have decreased tactile sensitivity. This is due to a decrease in the number of touch receptors in the skin. Okay, so next we will look at the 6-year-old children. So children are at the stage of life where they still need to develop the kinesthetic perception. Now, referring back to the elderly patient, they already went through the process of actually making the connections and having the ability to actually perform some functions properly, unlike children. But now it's important to notice that that fades away as you age. So your focus will be more on actually keeping the proprioception, or keeping that adaptation of the proprioceptive system, so that they can better perform everyday task, whereas in children you would want to develop that further. Okay, now thus it is also important that activities are included which develop their spatial awareness and body awareness, as this is not as developed as 70-year-old individuals. So that explains the difference why how we would prescribe exercise for 6-year-old children versus how we would prescribe exercise for 70-year-old children. So it's all just a difference in focus.